Welcome to our virtual Justice on the Block Legal Information Clinic. This clinic is part of the virtual series Know Your Child's Education Rights. This session, we were going to talk about getting mental health services for your child through the school system. I am Stephanie Johnson, Senior Attorney for the Tallahassee Office of Legal Services in North Florida. And I am joined by Cheryl Sadler, our Educational Advocate with Legal Services in North Florida. Just a quick housekeeping note, this video provides legal information and should not be considered legal advice. This video does not create an attorney-client relationship or substitute for legal advice you've been given by an attorney. You may have defenses that we haven't discussed here, so please seek out an attorney or legal help. It's always advisable. For more information about legal services in North Florida, you can go to our website, which is www.lsnf.org, or you can call us at 850-385-9007. So, Cheryl, what's going on with youth and mental health?
You can't really miss this issue. It seems like everywhere you look these days, there are stories about declines in youth mental health. So right now, according to statistics, 1 in 5 teenagers lives with mental illness in the U.S. That, of course, includes anxiety, depression, psychosis, eating disorders, substance abuse disorder, which we used to call, drug abuse and alcoholism, but now it's substance abuse disorder, ADHD, and disruptive behavior disorders. When you look at hospital admissions data, and the latest is from 2021, but we know that this is a trend that's continuing. There are national spikes, so it's going up in youth emergency room visits related to mental health. And in fact, in December, just a couple of weeks ago, the U.S. Surgeon General said the U.S. has a youth mental health crisis. Here's an interesting fact for you. Half of all mental illnesses begin by age 14. Mm-hmm. So it's pretty clear, and we're learning more every day, that mental health can affect nearly everything. It's really important to make sure that our kids get the help they need. And of course, we all want to prevent youth suicide.
And so what are schools doing in light of this mental health crisis for youth?
Well, schools get to do all kinds of things, in part because they're really the only institution that every kid goes to. And, there are kids who go to private school and they don't necessarily, but, we have almost 3 million students attending public school in the state of Florida. So there are really 2 things that are going on that impact all students. The first is training for school staff. School districts now have to make sure that the majority of their staff have had youth mental health awareness training. It's called Youth Mental Health First Aid. And basically, it helps teachers and everybody on campus recognize risk factors and warning signs of mental health problems so that they can say that kid probably needs some help. And the second is specific to kids' education. So schools are required to make sure middle and high schoolers receive at least 5 hours of mental health education each year. And that sounds like not a lot, but it's better than nothing. And that can include information on bullying, cyberbullying, which is, kind of huge now, sex trafficking awareness, as well as basic wellness and self-care. How to make sure that you can rebound from something negative that happens in your life. Oh, and then one more thing, Steph. School resource officers, those are the police in uniform in all of our schools, they also have to have mental health crisis intervention training. And the thought there is that when a child is, for example, having a meltdown, that those officers might look at that and say, does this child need help? Rather than, oh, this child is, being willfully disobedient and is a real problem and should be punished.
Okay, that's a good thing. So is it true that students can get direct mental health services like counseling at school?
Yeah, you don't really think about schools as being places where kids can get counseling, but they are now. ever since that horrible shooting at Marjorie Stoneman Douglas High School in South Florida, the legislature has given school districts not only school safety money, but mental health funds. And they actually have increased that every year, and it's just been increased again. So in order to get those funds, districts actually have to develop a plan, which makes sense, right? You don't just get a check. And these plans are all different, but they include things like mental health screenings for students, referrals to school counselors or community mental health providers. And also, this is really a problem in Florida and in a number of other states, increasing the number of licensed school mental health staff. Those can be counselors, they can be psychologists, social workers, folks who've had extensive training in mental health and working with youth, who can not only recognize a problem or a potential problem, but can also make sure that youth get some services that they need. Every plan, like I said, is different. So I've given you a link to your school district's plan. Frankly, these aren't very fun to read. And so if you think you want to know more or you have a specific issue, I would urge parents to call the school district and ask about mental health services. And I'm sure they can put this in a shorter, more accessible format than a 50-page report with lots of words.
So what kind of support can a student get?
This is really a lot about individual or group counseling at school. Once a child is identified as having a need, there is a required timeline to get that student referred and then get them services. And again, every district's a little bit different. And so it's hard to make any general statements about what's available. School websites sometimes have information on what's available. And every district, and this is also a new requirement in the law, every district now has to have a mental health coordinator. And that's great because it's one person who has to know what's going on in the district and its schools. So I've actually given you a link to those coordinators in every district. And you can email them or call them. I wouldn't hesitate to do that. Their job is to make sure that kids and parents get what they need.
So can any student get supports, or are there eligibility requirements?
Yeah, it would be so much easier if there were things that were universal. But Florida is what we call a local control state, which means that districts make a lot of their own decisions. So for individual issues, each district is really going to decide who's eligible. A lot of students will find themselves taking a universal screener, might ask questions about things like how many times they've been sad in the last week, how many times they've lost sleep, how many meals they've eaten in the last couple of days, and just things that are not specifically about mental health, but are warnings. It's kind of like an eye test, right? Everyone takes the test. It lets the district then identify the students that need extra support. So some districts may say, well, we're going to focus on depression. And some districts may say, well, let's see what the kids need, and then we'll do services. Florida schools, and this is true in academics as well as mental health and behavior, they're supposed to provide a basic program to all students. You sort of think about it as a pyramid. So everybody gets the bottom of the pyramid. And then as students' needs increase, it's fewer students, but they get more services. And then at the top of the pyramid, you have the fewest students, but the most intense services. And of course, when there's a crisis, a student gets bullied, they're grieving, they've lost a parent, they're having something in their life that's really disturbing, they should go to a school administrator. They should go to the guidance counselor and say, I need help. You don't have to, if the screener might be once a year, nobody should wait for the next screener to come around. If you have something going on in your life, ask.
And how does the school involve parents in all this?
That's a great question. Parent involvement is really important. period, and very much so in Florida. And parents do have the right to make healthcare decisions for their child, and that includes mental health. So school districts are, first of all, required to notify parents before they remove a child from campus for a psychiatric evaluation. That's what we call a Baker Act, and we've talked about that in some other webinars. So if you need more information on that, definitely look for those videos. Parents can refuse to have their child psychologically screened. And that's really important for kids who are 12 and under. Once you are 13 or older, you do not need parent consent to get a mental health diagnosis, to get therapy, or to get counseling. So that's kind of nice, right? Because we know that half of mental health disorders start by 14. And so 13, you don't need parents anymore. But parents are still required to be notified for all kinds of things. So if a student's mental health status changes, or if they're being monitored, parents are definitely still kept in the loop.
Well, and it's possible that the parents are one of the stressors that the student has. So
absolutely.
Yeah.
And so there are also, thank you for saying that. There are instances where if it's known or suspected that the parent is part of the problem, there are some exceptions where schools can make sure that they don't make that problem worse by, including the parent in that conversation. But those are very personal, individual decisions, and school districts handle those very carefully.
Are there other mental health resources that schools can help with?
There's a couple. The DOE's website has some resources for parents, and so I've given you a link to those. But I think it's important. There's this great service that a lot of families don't know about. If you have an immediate mental health need with you, your child, another family member, Florida has this thing called a mobile response team. And that mobile response team is actually a mental health practitioner, usually a couple. They will come wherever you are. They have to come quickly. They are available 24 hours a day, 7 days a week. And you just have to call a phone number. Now, unfortunately, it's not like 911, which is statewide, or 211, which is the statewide suicide help hotline. So I've given you a link to a map, and that map will show you, no matter where you live in Florida, the phone number for your mobile response team. And also, just another thing to know, anyone in Florida can call or text 988 for a mental health emergency. I also want to recommend that the National Alliance on Mental Illness has really terrific resources, especially for teens. So there are links to all of those, the DOE resources, the map for the mobile response teams, and the Mental Illness Association. But, I have to say, if you're having an emergency, that's not the time to read stuff. That's the time to make that phone call, because you need help right then.
Mm-hmm. So how will we know if these mental health resources in the schools are working?
That's the question of the hour. Florida used to participate in a national survey that basically grades states on how it's doing with child mental health. But this year, Florida pulled out of the survey, and it does its own. It's called the Florida Youth Survey. It was given in 2023, and we were supposed to see results about 6 months ago. We haven't seen anything yet. I'm hoping that it will be out and then we'll get some news coverage. Otherwise, Florida Department of Education is really just counting. But they're counting some important things, like the number of mental health staff that are added using these specific dollars, the number of students who are getting help, the number of students who are getting referrals. But it's really hard to gauge the overall need with the limited data that we have. So I think the best answer to that question is that we're going to know on an individual basis. So you are going to know if your child gets the help that they need. And, really, that's what matters. So, I love the research. I want to know if it's working statewide, but at the end of the day, did it work for your child? That's what's important.
Right. Okay. Well, this is an incredibly important issue. And I think we're all hoping that putting these mental health dollars into schools is really going to help these youth. So thank you, Cheryl. Appreciate it as always.
You're welcome.